Hi there, John Miller, the osteopath, and we're coming to you today to show you some exercises that I uploaded the other day that unfortunately didn't have any sound. I do apologise. Hopefully this will have sound and this will just help us to put some dialogue behind what I was trying to show people. Now, obviously since then, just to give you a brief update, I have had the AstraZeneca injection, the vaccination that is, the first of 2 doses, and that was on Saturday evening. And I felt pretty rotten on the Sunday, and now it's Monday and I'm gradually coming out of that, feeling a lot better. So it's only really 24 hours of feeling pretty rotten, but it wasn't pleasant. But I would say I'd much rather go through one day of feeling a bit rough than actually having COVID and being properly ill with it. So anyway, just to give you some background there, mainly because if you're coming to see me, you want a degree perhaps of confidence that I certainly want to protect myself and protect my patients for that reason. Anyway, on with the exercises. So put yourself on your back. It's going to work the transversus abdominis muscle. The transversus abdominis muscle wraps the whole way around your waist. It acts a bit like a giant corset, sucking everything in tightly. It joins the rectus abdominis in the front and the oblique muscles on the side, which help with rotation. But it sits deeper than those, and its job, as I said, is to hold everything in super tight. Now, if you get your fingers, you put them from the bone on your hip here, come up and in a little bit, and dig your fingers in here and here. Suck your tummy towards your back. You'll feel it lift into your fingers. Now, when you're doing this, I don't want you to tilt your pelvis. A lot of people tilt the pelvis like this when they're doing it, okay? And you don't want to be tilting because you're just working the rectus abdominis to some extent, not the transversus, okay? So you're just sucking your belly button towards your back. Now, suck that in nice and tightly. Breathe in for a count of 5 and breathe out for a count of 5, okay? Now, while you're doing this, okay, you're going to feel that as you breathe out, it starts to slacken a bit, okay? So make sure that as you breathe out, you actually suck it in a little bit tighter. Now, I'm not saying you've got to have a full contraction, but I would suggest, say, 25 to 50% of full contraction is sufficient. So we're going to do this for about 2 minutes. So breathe in, suck that tummy and breathe out, and suck it in even more. Now breathe in. That stretches it, and breathe out, and suck it in a bit more. Again, breathe in, and breathe out, and suck it in a bit more. With each and every breath, you'll find this tummy will flatten deeper and deeper and deeper. It'll give you not just a nice strong core, but aesthetically it will really help as well. A lot of bodybuilders used to do this technique, and they used to call it the stomach vacuum, and you see these people with these people like Arnold Schwarzenegger sucking their tummies in with great cavitation in their stomach to show how strong their muscles were. Now, we're going to do the next stage on. When you do these exercises, you want to do it for count of breaths, so I would suggest about 2 minutes worth, in other words, 12 cycles, okay, or 12 breaths in and out. So for each one is 5 seconds in, 5 seconds out. That's 10 seconds, so therefore 120 seconds, 2 minutes of breathing. Now the next stage is the leg slide. So what the purpose of this is to do is to stabilize the pelvis, because these muscles come into here, come up to here, and they help to keep it in position. If this is a bit loose, as you bend your legs down, what will happen is your tummy will lift and your back will arch. You want to keep this in a neutral position. Now, as I said before, you don't want to be forcing your spine into the ground. Okay, keep a neutral spine. You should be able to put your hands under quite comfortably, and they feel supported. So sometimes you can put your hand here, and you can push your fingers against your spine in that position just to tell you that it is in the right angle. Okay, but you don't want to be flattening your fingers with this. You just want to feel a little bit of pressure and nothing more. Now suck your belly button in towards your back. Breathe in to set yourself up, and breathe out and slide the leg down. And again, breathe in and slide the leg up, and breathe out and slide the other leg down. Breathe in and bring the leg up, and breathe out and slide the other leg down. Breathe in and bring it back up again, and breathe out and slide the other leg down. The whole time making sure you keep your contraction in those abdominal muscles, and as you breathe out, of course, make sure you really do suck that belly button in. So you're doing the opposite of what you normally do. Normally when people breathe in deeply, they suck their tummy in. You're going to do the opposite. You're going to suck it in tightly as you breathe out. And that shows you've got good control over your muscles. And most importantly, it's going to stop that pelvis from rolling forward more than it should, protecting the lumbar spine and providing stability to this area. That's what I said before. This thing is really good for dealing with back issues, because of weakness in here. Now the next stage in this exercise is to work the oblique fibres as well. So you're going to take that pillow, put it between the knees, get a second pillow if you have a bit of an iffy neck. The same thing, breathe out, and as you breathe out, drop your knees to the side to 45 degrees. Now a lot of people are telling you go all the way down. Don't do that. If you've got a disc problem in your back, you're going to make it worse. You get the legs go down to the 45-degree angle and no more, keeping the tummy tucked in the whole time. So sustain the position and suck the tummy tighter. And as you suck it in, bring the knees back up again. So you breathe out and let the knees drop to the side. And you breathe in and suck that tummy back in again. So you're using the abdominal muscles to do all the movements, okay? If you do it without the abs, as you bend from side to side, you find your lower back does all the work. Maybe not the glutes, but mainly the lower back. And that's not a good thing. So, and you'll notice, because your tummy will stick out a little bit as you do it. So remember that tummy will be sucked in, knees go 45 degrees and no more, and then back to the center, and then 45 degrees and no more, and then back to the center. The whole time, of course, as you breathe out, as you drop the knees to the side, you breathe in and suck that tummy in. Again, breathe out, knees to the side, and breathe in and suck that tummy in. Make sure all the movement that's coming from here is initiated from your core, okay? Right, so there you go, your 3 exercises. So you've got your basic breathing exercises set you up laying on your back, your leg slides, and your spinal twists. And each one should be done for 12 repetitions. If done correctly, as I said before, it's going to be 12 breaths, which takes 2 minutes. Anyway, good luck with those exercises. See how you get on. You can do these quite a lot because they're low strain on the body. Their purpose isn't to give you strength, but to give you balance and proprioception. In other words, so it'll help your body to know where your body actually is in time and space. And most importantly, because you're on your back, gravity is not putting spinal compression on there. So it's really, really good if you have a disc problem or sciatica or similar kind of lower back issue. Anyway, I hope you enjoy the exercises. Give them a try. Of course, most importantly, the golden rule is if it hurts, stop, okay? Try and adjust to make sure you're keeping the tummy tucked in and carry on. If it doesn't get any better, then perhaps you need to stop that exercise completely. But anyway, see how you go. See you in the next video. Take care. Don't forget to subscribe and like.